If you give me 1 day, I'm going to get you sedated. So you're going to be sleeping. You're going to be comfortable. You're going to have an amazing experience. I'm going to guarantee that. We're going to get any remaining teeth out. We just have to say goodbye to them. We get rid of any infections in your mouth. And I personally put in 4 to 6 implants per jaw, bottom and top. So you're going to have 8 to 12 implants in your mouth. Hey guys, Dr. Heath Lampee here for Teeth in 24 once again. What is Teeth in 24? And no one actually tells you. And I'm here to spill the beans, open the veil, throw back the curtains, and show you how amazing Teeth in 24 is, if it's right for you, and what's possible with it. Once the implants are in, you're still sleeping during all of this. We stitched up very, very well. And that surgery between sedation, taking the teeth out, getting the bone ready for the implants, putting the implants in, suturing, stitching everything, is going to take me about 3 to 4 hours. Now, that is the only time that you are going to go without teeth, 3 to 4 hours, and you're going to be sleeping that whole time. You're going to be taking a great nap because it takes my ceramists, real human beings, in my dental laboratory, which is on site, takes them 3 to 4 hours to make your teeth. So if we started the surgery at 7 a.m., we're going to be done with surgery generally around 10:30 a.m., sometimes 11 on a longer case. And then at about 2 or 3 p.m., I'm going to spend about 15 minutes and I'm going to install your new permanent teeth. I'm going to use screwdrivers and torque wrenches to put in your top and bottom teeth, and it's going to be beautiful. You're going to have a permanent smile. Nothing comes in or out. There's no snaps, there's no paste, there's no dentures, there's no going without teeth. So Teeth in 24 is the real deal. Now you're wondering, this seems too good to be true. I've been told that implants take months and months to heal. I need bone grafts. I don't have enough bone. Honest truth, fact, you're going to the wrong dentist. They don't know what they're doing. They don't have experience. I have all these patients that come in every week. They're like, I've been to another person. They said they didn't have enough bone. They wanted to give me partials. They wanted to try to save my teeth. I don't think my teeth are savable. And I'm like, I know your teeth aren't savable. And so you get the honest answers with me. You also get the best in dental laboratories. And it's me that does all of the work as well. It's not some random guy that shows up that says, hey, I'm here to do your surgery. No, we don't do that. You're going to get me for today, tomorrow, 5 years from now, 10 years from now. I don't think I've met one person in the last 5 years that didn't have enough bone for implants. And I didn't have to do bone grafting either. And I was able to do it in one surgery. So that is breaking one of the big myths about all this, is that, yes, this works. This is called full arch immediate loading. That's really what Teeth in 24 is at its core. And the way I describe it is when when you're a kid and you're swinging on trees and vines and you break your arm, you fall off your skateboard or your snowboard, you break your arm, you go to the doctor. The doctor is going to put a rigid cast on your arm for what, 1, 2, 3 months while the bone heals. And if the doctor didn't put that rigid cast on, your bone would be kind of floppy, it wouldn't heal well and all that. The teeth that I put on the day of surgery act like a rigid splint, like what the doctor puts on after your arm is broken. That's why this works so well. The teeth, the implants, are rigidly splinted together, acting like a rigid cast, and it makes the bone heal quicker and faster and more dense around your implants. It's simple as that. That's why Teeth in 24 works. The other myth is that this is going to be terribly painful. It's going to be brutal. It's going to be a bad experience. No, you're going to feel good afterwards. You're going to be sore for a few days for the first week. You might bruise, you might swell a little bit, but we have got all that taken care of, under control. And then honestly, in the second week, you're starting to feel very good. Now, I like to let the gum and the bones heal for about a month, sometimes 2 months. Usually after about a month after surgery, I have the patient in and I start making their final set of teeth. The bones healed then, the gums are healed, the gums have matured, I know the final gum position, and I start making the final set of teeth with the final gum position and the final bone position. And the final set of teeth that I start making at the 1 month mark after surgery, they're the zirconia ceramic teeth. They're the strong, durable, eat whatever you want. And also, for that first 6-8 weeks after surgery, I want you on a soft diet. I have a whole sheet on this, but I'm thinking soups, pasta, scrambled eggs, salmon. Go easy on them while the implants and the bone are healing. Once everything's said and done, you've got your zirconia ceramic teeth. I can generally get that done 6 to 8, have it totally done 6 to 8 weeks after the full surgery. What we do is I want to see you 1 time per year after that. I want to do a cleaning on your implants. I want to do an exam. I want to do an x-ray. I want to make sure that your implants are doing perfect, that everything is, that you're happy, that you understand how to take care of them with hygiene, with your water pick. And so that's how I'm able to make sure this is going to last the rest of your life. Seriously, once you get those zirconia teeth in your mouth that we make on site with my customized lab ceramics and all our own equipment, you're going to be able to eat whatever you want. They're going to be strong. They're going to be durable. You're going to smile. They're not going to fade. They're highly customized just for you by some of the best ceramists in the world and one of the best dentists in the world. And so we're honored to help you. This is a very humbling journey, and I'm proud of the work we do and the lives that we change.